Governor Mike DeWine has tested positive for COVID this week. His office says he tested negative on Sunday, but started experiencing symptoms yesterday. He's been prescribed Paxlovid and will work from home for the rest of the week. COVID-19 is on the rise across the country, including here in Northeast Ohio. And with school back in session, medical experts are warning parents to be mindful of increasing cases. Our Mitty Hicks has more on what parents should look out for. Mitty, good evening.
Good evening, Peter. So looking at the numbers over the last 3 weeks, cases have risen by at least 10%, and doctors expect that number to continue to surge with kids being back in school.
It'll probably be a little bit of a larger outbreak than what we experienced last year.
Dr. Amy Edwards says she's expecting more COVID cases as classes begin across Northeast Ohio. She says one indicator is that we're starting the school year with higher cases.
The difference between last year and this year is we did not have a COVID surge in the summer. So our back to school spike kind of built up from a level of 0.
But this year, Dr. Edwards says there's a summer surge, and what may seem to be allergies or a simple cold could actually be COVID, especially since the symptoms with the current variant are the same.
It definitely causes a lot of like sore throat, fever, that sort of stuff.
What also stands out to Dr. Edwards is the number of hospitalizations, because those are up too. Ohio.gov data shows 238 people were hospitalized last week, up from 192 the week before.
The problem with COVID is we literally just got done with a COVID surge all over the country, and it wasn't flu season, and people were dying at those kinds of rates or even slightly higher than what we would expect to see from something like influenza.
She says the best thing people can do, especially with young kids, is to continue to mask up if you're able to, continue practicing good hygiene by washing your hands, sneezing in your arm, using hand sanitizer, and don't count out antigen tests.
Those tests specifically for the viral proteins, not just PCR, which tests for genetic material. And if the virus is making proteins, then it's still replicating in your body, meaning you're still contagious.
Now, according to CDC guidelines, most people can return to work or regular activities if symptoms are mild and improving, and as long as it's been a day since a fever, Peter.
Important information to know. Mitty Hicks live in the newsroom. Thank you, Mitty.